السلام عليكم، أهلا دكتورة ابتسام.
هلا مرحبا، شو أخبارك دكتورة مريم؟ شو مسوية؟
الحمد لله, I'm good. It's so nice to see you again. Virtually,
Yes,
بس يعني still.
I know, and I think this is the only way we can meet, and I think technology has helped us a lot, and we should give a really good applause to all the technology companies and people who are working behind this.
Yes, alhamdulillah. I remember when I first met you, you were always sharing your knowledge. I remember I was studying. You were also getting ready for your Arab board exam. كنتي مشغولة, لكن في نفس الوقت you really, shared the knowledge. You're a great teacher. You're a great human, and we did our masters together. فأحس يعني I'm always inspired by everything that you offer, and I thought, why can't we share what's happening with the world from your perspective?
Yes. Well, you always, I think you knew me since I used to be a physician when I had a hands-on patient. And I always used to be very passionate about my colleagues, my patients, and about healthcare generally, because I really loved it and I always want to help people. And I really want to deliver the best healthcare to them whatsoever, under what circumstances it is. And by today, you know that we are facing a little bit of difficulties. Actually, it's not a little bit, it's actually a real difficulties time that we are going through the COVID-19 pandemic, which is, we have to be very cautious and careful about what we are trying to do. But however, we are very blessed with our government and all the initiatives that have been given from the top authorities, from the federal government, local authorities, and of course, all behind that is our leaders who supported the healthcare system and giving such a wonderful cares to everyone equally, with no any distinguish between whoever is living on our land, which is really tremendous kind of an approach, and shows the part of the humanity towards the people, where I think we are blessed that we are here. Of course, it's a challenging time because COVID-19 has affected all our lifestyle, and it's a quite like a turning key in everybody's life. So I feel like we will go back to what we used to do, but we will do it quite differently because of the mode of the transmission of the virus and how it's being affected the whole world and the people. And of course, that's had impacted the way of our normal practice in our life. So, I mean, before we used to go grocery shopping, we do everything. We didn't care about, we need to sanitize everything, and we need to wear masks whenever we are trying to go out because of the mode of the virus and how it's reacting towards us. But now we have to be very careful about whatever we do, whatever steps we are taking in towards our life. And that's not just because it might hit us, it might hit our loved ones who are, maybe they have a problem with their immunity, or they might have some kind of a chronic disease. So this is a quite challenging time. So as I mentioned, even to many of our colleagues and even different firms and consultancy firms as well, that basically COVID-19, it's a turning key point, change in the way of human being practice and their culture, as well as it has a great impact on the economy of the various stakeholders within the not just UAE, however the region, the whole world as well. However, some of these sectors is going to be affected a lot in terms of the positioning themselves in the market, but some sectors will be pretty much doing a very good job, and their economy state might boom and have a good turnover, and as well as they might have really good outcomes. With the current situations, I think technology is the major part which can make the life easier to everyone. And when it comes from the healthcare perspective, it will become more financial accessible as well as physical accessibility. So when I say financial and physical accessibility, means that having a virtual or you could say a teleconference or tele consultations will be cheaper than going to the consultant's office. The other thing, it's physical accessible, so that's mean the physician can do or run a couple of consultations in one at a certain period of time, so therefore the physician will be more accessible towards their catchment area or towards the patients or the people. So let's go a little bit back to the history. If you look about telemedicine or virtual healthcare, it's been existing and it was been evolving in this market. And there was a good kind of like a private companies who are engaged already. What I know from the Department of Health as well as the Ministry of Health and all the health authorities within the UAE, as well as some countries, the neighbor countries as well. So everybody had that kind of a concept, and people always were worried whether the technology will take the role of physician. It's not taking the role of the physician, it's basically enhancing the tool that the physician required in certain circumstances, so we can deliver the best of the care to the client, to their door. So therefore, without any physical interaction. I'm just talking about cases who can be managed virtually or could be managed through the telehealth. But of course, there might be some cases still they require to go to the emergency or to see the consultants when it comes to the kind of like an urgent care. But even though if the patient is admitted in the hospitals, virtually he can see the specialists or the physicians, so to reach to the best diagnosis and treatment. Now, my experience with this market, with the telemedicine, it's quite positive because we had that kind of a tool existing in this market. And the good thing about it, most of those teleconference or telemedicine companies are linked to the health insurance. So therefore, the patient should not even worried about how these services is being paid from the payment perspective. It's basically insurance being taken care. Now, if you go to the underdeveloped countries like Bangladesh, India, they used these tools long back. I mean, I'm talking about 2 to 3 years ago. And that's because they had a massive populations and they had a limited number of physicians and nurses. So the accessibility was difficult. And plus, financially, financial accessibility, it was even cheaper by doing it virtually or through the telemedicine. So I feel, and I think that's a very promising area that healthcare with technology will gonna go evolving the future in coming years. So
it's also better for the environment.
Of course. And then you don't need, unnecessary cases to come to the clinic or to the hospitals. Basically, you're limiting those hospitals only for really kind of like an urgent or emergent care. So, and you're focusing mainly on 70 to 80% anyway of your patients are the cold cases where they can be managed virtually. And some of the countries, I'll give you an example, like Israel has used the best primary healthcare services through their telemedicine by using the cloud system. So see the advance of that kind of services being given to their populations, including a screening program. So imagine if you want to screen your population from certain prevalence of disease, I think this is the best way to do, even bringing the services towards their door, monitor them, make sure that what kind of things that they have received, coming to the services or to diagnostic center for certain screening program, and giving the results back to the patients through a certain method of technology in a very safe, secure way, that the patients will be more confident about the service and how it's been given to them.
And what about some of the challenges that are affiliated with telemedicine, also in terms of data protection and patient confidentiality and that sort of function?
I mean, in UAE especially, because we do have a good policies in terms of the TRA, so the telecommunications authorities. So therefore, now, a certain program was banned somehow, but now with the COVID-19, the kind of like method of the communications is eased up. So that's even made the life easier for the tele companies. So, and in regards of the security basis, there is a pretty much a secure system that the government is adopting in their program, as well as the private sectors. And now, if you look at the Neuron program in Dubai, it's already linked with the 3 to 4 major providers in Dubai. So the patient has an accessibility to their physicians or to their providers. It depends on their cases. So you want to avoid as much as possible of patients coming to the hospitals for the chronic illness. So, and plus, if they require furthermore test or diagnostic, those can be delivered to their home, as well as the prescription medicines. So the security data is all will go under one numbers based on the patient's Emirates ID or patient's healthcare's number, and it depends what kind of insurance programs they do have.
So it's been a positive experience, and I think the systems were in place. Now it was just an implementing process.
Exactly. Actually, as I mentioned, telemedicine was there. Dubai had it, a few years back. And we as a DHA, especially who I'm coming from the investment and PPP department, I was working around the certificate of needs, where you really look at the demand and supply and what kind of the demand is there, so you can license those facilities. So telemedicine, there was a quite good amount of gap. So therefore, most of the investors were happy to invest in this kind of facilities. And this was before COVID-19. So therefore, we had an experience around it. The other thing, it's we were trying to build a policy around telemedicines. Especially if the providers would like to take a third or opinions from different parts of the world. So for a certain disease of the clients, that kind of we were working around the policy around that area. So where the licensing and regulations will pitch in, and how basically it will become more secure when they are consulting from different parts of the world to the patients through certain providers who have an accessible towards their own assigned patients.
And from a patient-centric perspective, when you're putting the patient's needs right now, how are they handling this? Are they enjoying it? What's the feedback?
Yes, basically, a lot of patients who have the chronic disease use those telemedicine tool. It was easy and accessible to them. Of course, there is a bit of challenges, because currently we are facing COVID-19, and on top of that, you need to take care of your own citizens and the residents from their current healthcare issues as well, on top of the COVID-19. So I think the healthcare providers and the physician and professionals, they're quite squeezed at this time. But I always say that to the patients, whenever you have any issues, use the telemedicines, which will be the best tool to avoid you to go to a hospitals or clinics where there is a COVID-19 patients, and especially those patients who have certain immunity issues. So better to stay home and to deliver that care towards their home. So it's been quite good experience, but I think we need to adopt it across all area, and this is based on the demography that we do have. Now, I know certain healthcare provider in private sector as well, they're giving mental health consultations for the patients who've been curfew or locked in, because it's a kind of tough time. Some people are going through tough experience, and that's because they never have been in such a situation before. So I know one of the private provider in Dubai already giving such a services to the patients from the mental health perspective.
When we talk about the NHS, they've been doing telemedicine for some time, and also for psychotherapy. So I think that there are so many lessons learned from that experience, and from all the different countries that went through this process. I think we're just also moving forward صح in a very difficult time, which makes it interesting. But بعد في نفس الوقت it's moving that whole process into existence.
Exactly, that's absolutely right. Because, see, I can't say it's a perfect solution and there is no default in it. There is, of course, any system that you apply, there is a pros and cons for it. Some people might love it, some people might hate it, because you can neglect human interactions. I mean, we are family physician, and we totally understand about how important to have verbal and non-verbal communications. The rapport, exactly, the rapport kind of like a system that you need to build up between your patients and the physicians. So but the thing, it's like sometimes with with some difficult times where they can't go out and they really need to speak to their physician, this is, I think, a fantastic tool that they can use. And of course, collecting those all data and then interpret them and build on them some kind of a research and look how that has an impact. Some countries, they have done that years back, and they found that the impact was really, really good, especially when you're talking about the Scandinavian countries. And as I mentioned, even Israel was one of the best primary healthcare setup in terms of virtual and using cloud system.
And how do you see this after, post COVID-19? Do you think people will still be going back to the clinics, or will they have found it much more easier to just access their healthcare through their apps?
Mariam, as I mentioned, it's a turning key, actually, the COVID-19 for all of us. I mean, it's a really good question. I mean, how things will look like once we go back to our normal lifestyle. I don't think so we will go as it used to be before, like in 2018, 19, or before that, because as I mentioned, social distance will have an impact, and it will have an impact, and it will be going on for a couple of time. I mean, for a couple of years. So I think that social distance, you will require technology, and it might be kind of like a habit that we need to adopt it in our day to day. So this is what I look at it from my perspective. And I think people will go back to the clinics, but still, I think there will be a time for physician where they will do telehealth consultations.
Amazing. Shukran, Dr. Ibtesam. This was so valuable, and it's so nice to connect with you over such interesting times as we are moving and reshaping the face of healthcare and the face of the patient or the client doctor dynamics. So thank you so much for sharing this. I know that you celebrated your birthday earlier.
Yes, I did. Yeah, exactly. I mean, my kids wanted to surprise me with COVID-19 virus cake, and I said, no, I don't need that.
Well, I wish
So,
you a belated
I
happy
mean,
birthday.
thank you very much. Thank you. And I wish everyone a healthy life and stay safe and try to stay home, entertain yourself with the different methods, stay healthy as much as possible, move around, exercise, give 1 hour of your time exercising and do something that you love, read books, maybe you can use different apps for different things and this is what you need to do. I mean, hopefully we'll go back to our life and back to our routine, but in a very careful way and in a more hygienic way, I would say. So God bless everyone, and thank you, Mariam, for this. It was a pleasure talking to you, and hope to see you in near future.
إن شاء الله. شكرا. مع السلامة.
Thank you. Take care. مع السلامة.
Bye.
Bye. Bye bye.